This is a video about how to prepare your child for toileting independently. Using the Montessori approach when addressing potty learning, we're going to meet them where they are, set them up for success, and take it really, really slowly. Just like you would when a child is learning to talk and to walk, we're going to start to make it a part of their daily routine. Traditional potty training is often a cram session over a 3-day weekend or some other adult-centered timetable that is prepared with rewards and maybe punishments. The Montessori approach is a much slower pace and a child-led process. The process can start sometimes between 12 and 18 months, but honestly, this slow process can start as soon as the child is walking, well before they might transition to underwear. The process starts with showing the child how to get dressed and undressed by themselves, as well as an introduction to what the bathroom is for and language around toileting. Just like other aspects of learning, we can describe what's going on and explain it in simple terms. Exposure to the room, the process, the routines, and the language begin well before the child is ready to move to underwear. As Montessori parents and guides, we will involve the child early and often in the activities they can do by themselves. We start slowly to incorporate toileting into their routine, and it's going to be a much more gradual, and they're going to start making connections between what's going on with their body and what they're seeing and what they're experiencing. Just like when you're baking a cake, you set up all the things to get ready before you begin. In Montessori, we call this the prepared environment. This works for the bathroom area too. Have all the things you need, have a basket of diapers, later a basket of clean underwear, right there. You might have a little potty for them to practice, or a step and a step stool and a seat reducer for them to use the big toilet. You might have a basket designated for the dirty laundry. We encourage stand-up diapering as soon as the child can stand. Stand-up diapering is a step towards independence and supports the child's introduction to toileting weeks before, maybe even months before they're ready to transition out of diapers. You can set up a place in the bathroom to change their diaper, like standing next to the bathtub where they can hold on while you sit on the toilet. When it's time to change their diaper, you can describe what's going on, and they will begin to understand over time. This process is pretty straightforward for a wet diaper, and it's appropriate to use a changing pad or changing table for the child to lay down if there's a BM. Let's help them by saying, hook your thumbs, push your pants down. Getting dressed and undressed is the starting point to toileting independently. We can expect their awareness to gradually increase over time as we make toileting a part of their routine. For example, telling your child, every time you get up from nap, we're going right to the potty to sit down and try. Or after every meal, we're going to get up and go right to the potty and sit down. You could also say, let's go pee before we go to the playground. I will pee and we will change your diaper. We'll wash hands and then we'll go. We're modeling the behavior and the routine, introducing how one takes care of their body. Let's go together and change your diaper. You peed. Okay, hook your thumbs, push your pants down. You got it. And I'm here if you need help. We adults need to manage our own expectations. The child will not always have any action when they're practicing sitting on the toilet. Be patient and practice. Children have accidents or misses often, and this is absolutely normal and natural as they are getting more familiar with their experiences. Remember, this isn't about rushing, but about including your child in the process early so they grow naturally into it. Some key signs that your child is ready to begin. They're showing interest in the bathroom or the toilet. They're curious around it. They're noticing when their diaper is wet or dirty. They're staying dry for longer periods of time. They're wanting to be more independent in their daily routines. So those are some of the signals that you can see. You might ask, what's the time frame? What kind of time frame should I expect? It's more about gradual learning than a really set timeline. Some children gain independence in a few weeks, and others take several months. If your child begins to regularly resist encouragement of using the toilet, that's normal. Take a break, keep the environment ready, and reintroduce gently. Pushing too hard often backfires. Montessori isn't about rushing or bribing or offering rewards. Instead, it's about natural learning process, patience, fostering independence through everyday practice. The problem with bribing and rewards is that it removes the child's intrinsic motivation to do whatever it is that you're wanting them to do. In Montessori, we don't use rewards or praise, so we really want to protect and nurture that child's internal motivation to understand and follow what's going on with their own body. Giving them the opportunity to really figure out what's going on and doing it on their own, you're going to see a lot more long-term success. Why are we all so squeamish when it comes to poop? It's true that poop can be kind of stressful for both the child and the parent. Often when they are a baby or a toddler, we tell them, "Ew, that's stinky," or "Ooh, gross, don't touch it." And then we expect them to poop in a tiny toilet and have it be right there next to their body and them not become upset. It's a little confusing, or it can be. Instead, we need to shift a bit to prepare the child a little bit ahead of time, shifting away from "ew, that's yucky" to simply start saying, "This is poop, you pooped." Begin talking about this as something that happens to all of us, and just sort of taking the mystery and the grossness as much as possible out of poop. Yes, your child really can wipe their bottom by themselves. It may seem like their arms are too short, but it's actually possible for them to wipe themselves. They won't be great at it to begin with, but they should practice. You can show them how to give it a look and see if they are clean. You can certainly wipe them after they have their turn. When your child transitions to underwear and you wipe them after every BM, they will likely expect you to wipe them after every BM. And they might resist practicing wiping themselves, especially if you talk to them about how gross poop is. Don't get stuck in a rut. They will learn. You need to let them practice, and you can be their backup plan. It's also helpful if we can switch our expectations too. There's going to be some pee on the floor. There's going to have occasional accidents. There's going to be some poop on the floor once in a while. And we're going to be okay with that. This is the time that they're learning. They're going to have some big accomplishments all to themselves. And this is going to be something they feel really good about. If possible, it's a good idea for parents to model going to the bathroom in front of their child so they can see. We think about all the things and all the ways that we model for our children every day. That's how they learn. They learn to talk because we're talking to them. Nighttime and nap time may take a bit longer for your child to stay dry. Research shows that children don't actually control their urine production at night, and that production is actually driven by a hormone. If your child's body hasn't produced enough of that hormone yet, your child is going to have a very hard time staying dry overnight. So we recommend waiting until your child's diaper is consistently dry when they wake up to make the switch to wearing underwear when they're sleeping. Potty learning doesn't have to be a stressful event. It can be a natural, empowering milestone when we approach it in the Montessori way. By preparing the environment, introducing the potty early, and respecting your child's pace, you can set them up for success while building independence and confidence.